Hello, this is Brian Casey, and we are here at RSNA 2022 in Chicago. We are here with Sandy Coffta. She is Vice President of Client Services at Healthcare Administrative Partners. They are a firm that helps with coding and regulatory issues.
Revenue cycle management.
Excellent. Sandy, thanks for being with us today.
Good to be here.
Yeah, so radiology is driven a lot by reimbursement issues and regulatory issues, and you guys really stay on top of that.
Absolutely.
What are some of the things that you're really tracking right now?
Well, one of the consistencies at this time of year at RSNA, we always come out to Chicago, enjoy the brisk weather, and deal with the question of Medicare cuts for the coming year. At this point, going into 2023, we're currently looking at cuts of around 10 to 11%. Primarily due to a 4.4% reduction in the Medicare conversion factor, and that was included in the Medicare final rule published at the beginning of this month. Fortunately, we do know that there is a bill, the Supporting Medicare Providers Act of 2022, which is up to 98 co-sponsors as of, I believe, this morning, which would negate that 4.4% cut and bring things from kind of that catastrophic 10 to 11 down to a little more manageable level. And we are also hopeful that the 4% Paygo cut, which is required for budget neutrality in response to the American Rescue Plan COVID Relief Act, that will be again deferred as it was at the end of 2021.
Now, cuts of 10 to 11% in reimbursement are huge.
Tremendous.
How optimistic are you that this bill is going to get passed?
We are fairly optimistic. There is bipartisan support, which is a great indicator of the potential success of the bill. There's definitely bipartisan support. There's support across medical specialties. We see the AMA, ACR, all medical societies weighing in on the catastrophic impact of these cuts, particularly with the growing Medicare age population.
Okay. And how long do they have to pass this bill?
Ideally, we will see this pass before December 31st. And typically we see real movement on these things kind of in mid-December. Typically, we're looking for that to wrap up before the Christmas holidays.
Okay, well, we'll keep our fingers crossed. Now, what other things are you guys looking at?
The other big deal would be prior authorization reform.
So prior authorization is when a referring physician has to get approval to
Yes.
order a scan. So
Right.
that's important to radiologists because if the prior authorization
Right.
is really restrictive, that means fewer referrals are coming in.
Right. If the prior authorization isn't obtained, the radiologist and the facility are not getting paid. So that's a major issue. And there have been studies showing that for Medicare Advantage plans, about 13% of studies which would be approved under Medicare policy are being denied under the individual policies of these Medicare Advantage plans, and obviously that needs to be fixed. In addition, 82% of physicians are reporting that they've seen patients delay or defer care entirely because of onerous prior authorization requirements.
Okay.
So it's not just a reimbursement issue, it's a patient outcomes concern. But we are seeing movement toward federal prior authorization reform that would limit the time that can be taken to process an authorization request, and that kind of sets standards that holds Medicare Advantage plans to follow Medicare policies. And also, if those deadlines aren't met, that the authorization would automatically be approved, which is a major change from past legislation.
Okay, so is that something that you think will happen?
It is looking promising. At this point, again, bipartisan support generally, where you see things that affect the health of senior citizens and Medicare, you do tend to see more bipartisan support there, so we are optimistic at this point.
Well, let's hope that we see that. Anything else on the horizon?
Just basically keeping an eye on changes to the value-based care and MIPS. They continue to narrow the available measures for radiology, and we're certainly keeping an eye on that.
All right, very good. All right, well, thanks so much for being with us.
Thank you.
Signing off from Chicago, my name is Brian Casey.